So what do you think we're gonna do in class today?
Oh my God, we gotta do that darn presentation today.
Oh yeah. Hopefully it won't be too bad. You got to study for it. I'll help you.
I don't know, but I really don't like talking in front of a lot of people. I don't know. I hope it's not too long. I hope she just let us go first and get it over with.
Yeah, but I'll be there with you, so we'll get it done together. All right, well, I think it's time for us to go ahead and go in. So, you ready?
Come on in, class.
Good morning.
Good morning.
Come on, Dee.
All right, have a seat. All right, so welcome back to Nursing Psych 101. And what we're gonna do, we're gonna go ahead and begin with lecture this morning on chapter 15, and we'll be discussing social phobia. Okay, so as we all may know, human beings are, by nature, they're really social creatures. But for some, social scrutiny has really been an extreme source of anguish. Now, with social media today, more and more people have increased social phobias. And this is really due to the unrealistic expectations and the pictures that are presented on social media. And this really paints a real false perception of what social relationships are like and what life should look like. Emily, do you have a question?
Yeah, what is social phobia?
That's a really great question, Emily. I'm so glad you asked, because today we're going to discuss the etiology as well as the clinical description for social phobia. As described in your books, there in chapter 15, if you want to follow along, it actually talks about social anxiety disorders, and social phobias is one of the disorders. And so with social phobias, the person's really constantly thinking about what others thinks about them. They're constantly analyzing their thoughts about, when they're in a social setting, how they'll respond. So you may want to know, well, what are some examples? Well, let's talk about it. There are situations that really trigger this distressing situation for them, and some of them include not being able to answer questions, like right here in the classroom, or looking awkward while eating or drinking in front of other people. For some, they're afraid to perform on a stage, or like you guys have presentations today. Some people, that's really terrifying for them. So those with social phobias or this social anxiety disorder, they tend to cope by simply avoiding these social situations altogether, just avoiding them. So if they're unable to avoid them, then they find themselves in a really precarious situation, and that is emotional distress. So with the social phobias, it's really recognized as a relatively common and significantly impairing anxiety. It's one that, when it comes to psychiatric disorders, it's been several different models of the etiology of the social phobia. And these have been derived from converging evidence of interacting biological and environmental contributions. But y'all may be like, Miss Tiffany, what does this really mean? Let's put it simply. So we're all predisposed to having genetics, right? We have DNA, and we're all born with this ingrained personality that we have that develops over time. But when you couple it with home environment, school environment, work environment, and social settings, sometimes those interactions create in an individual social phobias. Now, if you look in chapter 15, your book really discusses the biological preparedness for the fear that those with social phobias experience. So with those factors, that's something we're going to consider a little bit later. But let's just say no one seems to be exempt. Even really talented and professional people have been found to suffer from social phobias. And you'll see some examples in your book there on page 165. So, last but not least, let's just reiterate the clinical facts. The trait of shyness is also a strong possibility in those with social phobias. And having parents who are shy, this really carries a double risk of having the genetic transmission and the parental modeling. Because parents may set an example of isolating their child and withdrawing from social environments. So chronic social isolation may be actually a risk factor at increasing this risk for also major depression. So there are several comorbidities that you'll want to think about in terms of looking at patients who may have this social phobia. And one of them is bipolar disorder. Additionally, children have been seen to have really high functioning autism. And as with many anxiety disorders, females in this instance are more likely to be affected. So what we'll want to do now is we're going to end our lecture here. But we have some presentations that we're excited about, and we're going to start with group 1, and that will be, let me see in my notes here, that will be Dee and Emily. So we'll welcome up Dee and Emily, and they're going to present to the class their research on the prognosis for social phobias.
I don't want to, my stomach hurt.
Oh, Dee, come on. Just stand with me. All right, you guys, so I'm Emily and this is Dee. She said her stomach hurts, so I'm gonna go ahead and she got everything together for us. So I'm gonna go ahead and read it, okay? All right, let me see, Dee. Here, get over here for me. Okay, so for social phobia, Miss Tiffany wanted us to look up what a prognosis could be for it, okay? So what's gonna happen if you don't get treatment? So if you don't get medicine or therapy or anything of that such. So, like I said, Dee wrote it down. If untreated, social anxiety disorder can become chronic and increasingly life-limiting. Over time, people will find it hard to fight the anxiety, and it can generally just make it really hard to maintain, okay? And live a normal life is not very easy for them. 80% of people who suffer from social phobia often find relief in their symptoms over time, okay? But things that it can be used to get treated with could be cognitive behavioral therapy, which is using a combination of the cognitive part of making you stop those negative thoughts and replacing them with more positive feelings. And then behavior, you know, like thought stopping, or what they call like bringing it in a little bit at a time to introduce it to them, or often medication. Sometimes these are both treated together, or treat the symptoms together, and that's the best way.
Thank you so much, Emily.
Come on, Dee.
And Dee, good job. So we'd like to thank you all for your presentations. You guys can have a seat. So now, class, what we're going to do is we're actually going to watch a video on social phobias. But before we watch the video, I just want to give you guys a reminder. In 4 weeks, your next homework assignment is going to be group 1, Emily and Dee. You will have the assignment of the presentation on social phobias, making sure that you include the community interventions and the nursing diagnosis. All right, so now we'll watch the video.
Miss Dee? Miss Dee? Hi. You come on in with me? You come in by yourself?
No, can my sister come with us?
Yes, of course. We love to bring in family. Come on in, Lucy. So, my name is Emily. I'm a psychiatrist. We're just gonna talk today and see how you're doing, okay? So what are you coming in for today? What has been going on?
My sister said I had to come.
This is your sister?
Mm-hmm.
Okay. Would you be okay if your sister like gave me some insight on why she thought you should come?
Well, she asked to.
Okay, so Dee's kind of been experiencing some things that I've been noticing for a little while. Since we were really teenagers. We used to cheer together, and I noticed that she started like really being concerned about what people thought, like if she led a cheer. And then like we have family functions, and you know, we really enjoy our family, so we play a lot of games together. But I've noticed that Dee's been really reserved and not really participating in like family functions, and just really withdrawn. The other thing was she does really well at work, and she was actually supposed to be honored at a program for all of her coworkers, and I noticed that she started getting really anxious about it, like the closer we got to the date, and she didn't want to go and accept her award.
Okay.
But what actually brought us here today was she was accepted to nursing school.
Mm-hmm.
She loves caring for patients. She's been a CNA for a while, so she got accepted. But she had an assignment at school. And I was really concerned because she said she got really nervous and she was talking to her partner and she didn't want to like go in the classroom. And she said even when she got ready to do her assignment, she froze up.
Okay. All right. In the past, Miss D, what have you done in these situations? That's something I need you to tell me. So, like, what has ever helped you? Any breathing or anything like that? So I have, yeah, of course. So usually, because I have a history of as being a nurse as well before I became a psychiatrist. So usually, sometimes I'll do a full physical assessment. Would you be willing for me to do that? No? Okay. So, let's see. Well, before we get started, I'm going to have some questions to ask you, okay? What we use is called a fear questionnaire, okay? It's just a few questions. It helps us determine what type of anxiety you have that's going on, okay? Would you like a glass of water or something to eat while we do it? Okay. All right. So, all right, let's see. So, the first question is, I'm going to need you just to let me know how much on a level of 0 to 8, okay, 0 being no, I would definitely avoid it, or 8 being no, I'd be more willing to do this, okay? So the first one is going to be that I need you to answer is, how are you with eating or drinking in front of other people or with other people? A 2. So you would say that, you probably avoid that one. Okay, another one that I need you to answer for me is, how do you feel about being watched or stared at?
Oh, 1.
A 1, okay. All right. What about that I need you to answer for me is talking to people of authority. So you could even consider it like a teacher, like how do you feel going to them to talk to them? A 2, okay. All right. What about, how do you feel about traveling alone or by bus? Does that bother you at all? Okay.
We always do stuff together.
Okay. All right. Last thing that I need you to answer for me is, how do you feel about speaking or acting out in front of audiences of people? Not at all? Okay. All right. So what it sounds to me is that it could be what we would call a social phobia or social anxiety. Okay, it's very common. Nothing that's wrong with you. It's a chemical problem. Okay, it's things that we can treat with therapies, and you coming to see me and getting more used to talking to me, just like how you talk with your sister. Okay, so your sister can be incorporated into these therapies. All right. So I'm going to give you a few things I want you to try, and while you're waiting to come back in for a follow-up with me, okay? So these therapies could include relaxation. So before you have to talk in front of people, or before you need to go to a place where there's a lot of interaction with others, even going to the mall or something like that, or even eating in front of people, if you have a family dinner, just take a deep breath, okay? Or if you're worried of people talking about you or the way that you're doing something, we use a technique called thought stopping, okay? So what I want you to do is, those thoughts in your mind of, oh, they're gonna look at me a certain way because I swallowed my drink this way, you're gonna say to yourself, stop, okay? So this will help you with, pursuing in what you're doing, all right? And take a deep breath. Before anything that you would do, you want to just go, practice that with me, okay? Just take a deep breath, okay? How about practice it with your sister? Would that be better?
Do it too.
Okay, so your sister will do it.
We'll do it at the same time.
So take a deep breath. You're going to go in and out, okay? And sometimes you have to sit there and do that for a couple minutes beforehand, all right? And one more thing that I want to do for you is, there is certain medications that we can try, okay? And these could include, there's a top 3, okay? The top 3 are usually called Effexor, Zoloft, and Paxil, okay? With this being so new to you, the one that I would prefer to start you with would be Paxil. And the reason I say it is because Paxil it results in a more calming effect instead of sometimes the other 2 can do the opposite, okay? All right. And these medications, they work with, we'll go back to those chemicals that I said in your, like, have to do with your brain. These medications are going to balance them, okay? So they're going to help with replacing the things that aren't there, okay? So we'll get that started, and then I want you to come back, okay? And bring your sister back, because family is important, friends, to help with your therapy, okay?
So you're gonna do great.
All right, so I'll see you guys back in 2 months, okay?
Okay,
All right,
see you
it was
then.
nice meeting you.
Thank you, Dr. M.
You're welcome.
All right, class, welcome back to Nursing Psych 101. So what we'll do is we'll go ahead and start this morning with Dee and Emily, group 1. You guys will come up and go ahead and do your presentations on social phobias, community interventions, and the nursing diagnosis.
Come on, Emily. Come on, Emily. Come on, girl. We got it. Come on.
Hey,
Come
y'all.
on. Come on. Come on.
Okay, so first we got the nursing diagnosis I'm going to tell you guys about. So it's
Hold on, Emily. I got it. Let me tell them all about it. The nursing diagnosis we came up with was severe anxiety related to social phobia, as evidenced by picking skin, pulling your hair, and having those panic attacks. For me, I learned that we could also take the medication, but also the most important part, we had group therapy. With those group therapies, we learned to talk about things. We learned how to take things slow. We learned how to deep breathe.
Yeah.
Along with that, we also, with my church, I joined the choir, Emily.
That is
Can you
so
believe
good.
that?
That's
I am
a
actually
really good
singing
thing.
in a group. I'm just singing. It is so wonderful. Learning to deal with these different types of social phobia is awesome.
It's Dee.
Hi, how are you doing?
I'm good. How are you guys doing
doing
today?
well
I'm glad
today.
you brought your sister back with you again this time.
I did.
All right. So, as last time we saw, you would not even look at me, so I love to see you smiling and everything. Your sister's smiling, so that's great. How have you been in the last 2 months? How's
I've been
medicine?
doing wonderful. I asked my sister all about it.
Really?
I've been going out and about. I've been attending my group sessions, taking my medications. I just feel wonderful.
That's
I feel
awesome. I
wonderful.
see you in your nursing uniform. How's school been?
Oh, school is going wonderful. Grades are
Good.
picking up. We're having a wonderful clinical assignments. Just having a great time.
You're interacting more with like studying and everything too with other people.
We have groups, and we have study groups all the time.
Don't forget to tell
we
her
get
about
to
your
meet.
presentation that you did. She did so good.
Yes,
Really?
we had a presentation, me and a couple of girls in the class, and I was able to take a deep breath like you told me, get my thoughts together, and able to
Good.
present my materials to them. So it was wonderful. It was
That
good.
is
It's
so
good.
good.
I'm very
You're doing
excited.
so
I'm very
good.
excited.
Well, great. So before we get ready and sell some more things and talk about what we can do first, would either one of y'all like some coffee?
Oh, I love some
Sure.
coffee. Yes,
Thank you.
I love some coffee. Yes.
All right.
Thank
Oh my
you.
God, just so nice and thoughtful of you. Thank you.
You're doing so good. I'm so happy.
Yes.